Hey guys, Dr. Gary Linkov here. So let's discuss Madonna and see what facial procedures she may have had over time. Stay tuned till the end. We'll go over the summary of the surgical procedures and their cost, and I think you're going to be shocked at the total amount that may have been spent on keeping Madonna as beautiful as she is. We're super grateful to all of you who watch our content. We're going to give away $100 again to another lucky winner. Here's the winner of the last game. Look at the bottom right of your screen. There's going to be a letter that pops up. Throughout the video, there's going to be 4 letters. You put that together into a code, you go to my Instagram at drgarynyc, and you just send us a message, and then we pick a random winner to announce during the next letters game. So in 1982, she was 24 years old, and I'm looking at this photo, and I just love the hair. I mean, it's absolutely amazing. Keep an eye on the height of the hairline, by the way. More on that later. She just has these like beautiful full eyebrows, and look at like those eyes. They're just like piercing at you. Really just so nice. She's got this great nose. I think it matches her face perfectly. She has very nice cheek volume in this image, and it just looks very natural, right? This is what natural looks like. This is someone who hasn't had fillers placed and hasn't kind of had any major surgeries or anything really at this point. So the lips, for example, also just look natural. You have that nice pillowy look. The bottom lip is bigger than the top lip, which is actually a very classic normal aesthetic. Look how sharp her Cupid's bow definition is, just looks really good. She has a nice strong mandible, clean jawline, and the neck looks perfect. That is her at 24, that's Madonna. 1983, note how youthful the eyelid area is, the upper eyelids. See how full the infrabrow area is under the eyebrow. That is a hallmark of youthfulness, and that's something that as we age, it becomes more and more hollow, and we lose that fat pad in that area. So she has no hollowness there. She has a nice clean transition between her lower eyelid into the cheek, and you don't see any kind of tear trough that we all get over time because she's only 25 years old in this image. 1984, not seeing any major changes compared to prior. 1985, about the same. Things are still looking very youthful. I don't see any signs of any major procedures being done. 1986, age 28, and you're starting to see here the early signs of mid-face aging, and that basically is caused by 2 primary factors. One is that over time there's a descent from gravity of the tissues, they start to fall, and number 2 is that there's some atrophy going on, there's some loss of volume. So you're starting to see like this increase in the nasolabial folds, right? They're just becoming a little bit more visible, and that's because the lateral cheek is starting to fold inwards. 1987, again, the eyebrows are back and they're better than ever. So look at that fullness there, and you are again seeing the mid-face starting to kind of slowly fold inwards, in and down. That's what happens as we age. And so when we do any kind of surgical procedure, for example, we're trying to reposition it up and lateral as opposed to in and down. 1988, age 30, she's looking great. I'm not really seeing any major changes from prior. 1989, same thing. 1990, this is where it starts to change. Take a close look here. She's 32 years old. The hairline, to me, looks higher. Compare it back. Look at the difference compared to how it is now. It's higher. Now, maybe it naturally progressed backwards, and that's possible, though unlikely. It's much more likely, in my opinion, that at this point, or maybe the year before, or sometime within that last year, from 89 to 90, she had had a brow lift. I think. At that time, endoscopic brow lifts weren't really a thing, even though endoscopic brow lifts can also raise up your hairline. Probably she had some sort of a coronal approach behind the hairline, big incision to kind of lift things up. As you do that, as you lift these brows, the hairline comes up, so that's like a telltale sign. So I think it's elevated her brows and it's kind of fixed the eyebrows in position, but it's also raised her hairline. So that's what I'm noticing there. 1991, again, note the higher hairline relative to her earlier photos. 1992, this image is a little bit difficult to interpret, but it doesn't look like a whole lot has changed. 1993, age 35, not too much has changed from prior. 1994, it looks to me like she may have more of a fill-in in the mid-face in this section out here, and there's less of this medial bunching. So How is that possible? How did that happen in 1994? Here's a clue on this next image in 1995. At age 37, take a look at the left tragus. So that's this part of the ear right here, the front part of the ear. It doesn't look normal. It looks like it's expanded in the vertical dimension, and it's lost a lot of its character. It just looks out of place compared to the rest of the ear. And to me, that's a sign that she probably had a facelift, right? So you can see that change of the tragus. It's bigger, the shape has changed. This is a sign of a facelift. So I think that can explain the anatomical changes that we're seeing on that last slide that I just showed you, and because it looks to me like she may have had her first facelift around this time. We'll talk about this briefly, when people should get a facelift for the first time. The issue with starting young, like in your mid-30s, is that you're just going to need more of them over time, because we know that facelifts, they generally don't last more than 10 years. You pretty much just are then subjected to probably needing more to keep up with the aging process. So that's one of the issues with starting early. You know, I understand that there are definitely signs of aging that happen in their late 20s, early 30s, and people are seeing that and they get frustrated and they want a fix. Sometimes they want something more than just injectables. You know, it's one of the downsides of starting early, because as you'll see, she had additional procedures, additional facelifts. Now, 1996, I don't see a whole lot that's changed. 97, also not much has changed. 1998, age 40. Notice the lengthening of her face compared to age 25, and she went from a sort of rounder face to like a longer face, and even the philtrum under the nose has started to lengthen as well. And we know that that's something that happens, and that's why people come to me for lip lifts. The mid-face lateral cheek volume is declining, and it's starting to droop again. In 1999, what I'm noticing, especially in this image here, is that to me it looks like she has some ptosis of her left upper eyelid. And ptosis is something that happens sometimes from birth, and sometimes just from wear and tear on the body, and other times just from surgery in that area. But it's the actual muscle that helps lift the eyelid that gets impacted. When that happens, it's not enough to just do a blepharoplasty, which is just oftentimes removing skin. You have to go in and fix that muscle, fix those ligaments that have caused that descent of the eyelid. And so as you'll see later, the ptosis actually gets repaired with a subsequent surgery. So you can see how the left eye, the eyelid is down a bit, and her eye is looking a bit more closed on that left side compared to the right. So it's just an observation. The year 2000, she was 42 years old, and she just looks more volumized to me. This suggests that maybe she had fat transfer performed. Maybe there was some filler placed. But in the year 2000, the only FDA approved filler product was actually collagen. And the first HA filler, hyaluronic acid filler, was actually approved in 2003. It was Restylane for the nasolabial folds. In 2001, age 43, take a look at the upper eyelid hollowing, and that goes back to what I was saying previously, where when she was younger, that was filled in and it looked more youthful. As we get older, there's that hollowing that occurs. And part of the reason why you get that hollowing isn't just because you lose some fat in that area. It's also because the bone is starting to resorb. Our bone health is the greatest at around age 25. And then as we get older, it starts to decline. And so the eye socket changes as well. So the underlying skeleton of our faces is changing with time as well. The lateral canthus, which is this portion of the eyelid all the way on the side here, and the lower eyelid, to me, starts to look like it's loosening and it's starting to descend down. You'll see in later images that gets corrected and gets tightened up. So notice the change in the cant of the eye. It goes from kind of swooping up to being a lot more leveled, as you can see in this image. And she has continued mid-face descent. And I'm starting to see some early jowling as well. 2002, not much has changed. 2003, age 45, I think at this point she's continuing to get neuromodulator, such as Botox. I think the volume overall is partially restored again, so maybe she's had more filler. I think she's continuing to do the non-surgical stuff throughout these years. Some of those years are punctuated by actual surgeries, but the rest of the time she's doing non-surgical treatments on her skin, neuromodulators, fillers, that sort of thing. 2004, age 46, not much change. 2005, age 47. So now it's been about 10 years since her last facelift. Like we talked about earlier, 10 years is about the upper limit of how long a good facelift will last. So it appears to me like she's gotten another facelift at this time, 2005. 2006, age 48, you can really see that the mid-face shift is there and the jawline has been tightened from that second facelift, and I think she's looking really nice. It's likely that she's also had that coupled with upper and lower blepharoplasty or eyelid surgery, and maybe by this time most likely a revision brow lift as well. 2007, not too much has changed. 2008, she's now 50 years old. I think her brows are at a great height and she has nice shape preservation to the brows. They're not over plucked at this point. She has nice cheek volume and has that heart shape preserved face, and that's really nice. 2009, take a look at the upper lip. To me, it looks like the Cupid's bow area has lost some definition, which occurs with time. There's a flattening to the Cupid's bow. And also in the neck, you're starting to see some neck banding. And it's unclear if she's had a platysmoplasty to go along with her facelifts, and that's what allows for that medial tightening of the platysma muscle to reduce that banding. It can also sometimes be addressed non-surgically with Botox, but it's not as effective. 2010, this is where she has this like puffy look starting to develop. I think that she's starting to just look overfilled here. Throughout the cheeks, throughout the lips, everything just looks really filled in to the point of not looking as natural anymore, in my opinion. 2011, age 53. Take a look at that left eye. Notice how that ptosis, that upper eyelid slight droop, has been addressed. It now looks a lot more open, which is interesting. 2012, not too much change. 2013, continued use of neuromodulation and maintenance filler. 2014, to me, she's starting to show some sequelae of having had facelifts in the past. And so you can see this line forming. It's going from the oral commissure, which is the side of the mouth here, all the way under the cheeks, all the way back. And that has been described by some as the Joker line. And it is basically because as you pull on the smaz layer, and we have a whole facelift talk that we're going to be putting up soon, but as you pull on that smaz layer for a facelift, and if you don't release that layer from the mimetic musculature, which are the muscles that actually move the face, you can sometimes create a pulling on those muscles, and that pulling can be obvious in pictures such as these. So that happens, and it's also a matter of how the face is redraped later on as well during the facelift. So 2015, age 57, not much change. 2016, I think she's had a significant filler boost to the mid face and to the lower face. Maybe she's had some implants placed, it's unclear, but definitely a whole lot of filler. 2017, age 59, pretty much looks similar. 2018, similar. 2019, age 61. Take a look at her brows and note how the hair of the brow has really declined over time. It looks like it's been replaced by makeup and microblading over the years. And that heavy volumization of the mid-face and the lower face continues. And it's starting to look a little unnatural. She's looking full, but it's almost too full. And she has this deepening of the nasolabial folds that's occurring. So 2020, this is where you see another major change. Age 62. It looks like she's had another facelift, right? Facelift number 3. And likely another brow lift and the blepharoplasty on top of the significant baseline filler. She's had probably so many different types of filler placed over the years that it wasn't so easy to just dissolve it, most likely prior to the facelift. So you have all this fullness and then you do a lift on top of that and you really kind of create this look. The cheek hollowing that you see here might be from a buccal fat removal that was done along with the facelift. And this is where some people would describe this look as kind of more alien-like because of that really large upper face, that overfilled upper face, and then the more narrow lower face. She doesn't look 62 here. I mean, she looks more youthful than that, but there's certain elements that look a bit less natural. Age 63, 2021, the face has been lifted like we talked about. There are some signs of aging though in the neck, and the neck never lies. And so that is something else to be careful of when a facelift is being done, it's very important to thoroughly address the neck, or else, you know, the neck starts to show your age and the face looks different, and there's this mismatch. So let's summarize what Madonna has had, in my opinion. Again, I don't really know. I'm not her treating doctor, obviously. So in summary, I think facelifts, neck lifts, she's had 3. Brow lifts, 3. Upper and lower blepharoplasty, at least 2 each. Left ptosis repair, buccal fat removal, many syringes of filler, possibly fat transfer, possibly some cheek or jaw implants. So let's summarize the cost of what maybe that could have all been. The facelift neck lifts take a range of $10,000 to $50,000 per surgery. Brow lifts, I took a range of $5,000 to $30,000, and I basically placed her somewhere in the middle of that. She probably paid on the higher end, but let's just give a range first. Upper and lower blepharoplasty, about $10,000 to $30,000. Left ptosis repair, maybe her insurance covered that. Usually that's something insurance could cover, or they were just maybe threw it in there as a little gift with the other cosmetic work. Buccal fat removal, $3,000 to $10,000. Fillers, anywhere from $500 to $1,500 per syringe. And I think she's had over the years probably at least 30 syringes, probably much more than that. And I didn't include here any fat transfer implant prices, just because I'm not sure if that was done. So if you take like the middle of the road prices for each of those types of surgeries multiplied by how many of each type of surgery she's had, my calculation is that the estimated total for all of Madonna's surgeries and some non-surgical procedures were somewhere on the order of $215,000. Now remember, this is probably a gross underestimate, because she's had skin resurfacing, she's had a lot of other just like regular maintenance types of procedures. So if you're looking at, you know, total amounts spent on surgical and non-surgical work to keep her face looking fresh, it's probably double of what I just said. So that's just a guess, but you know, one that I think is not too far from the truth. So maybe even up to, you know, $500,000. But if you look at her needing her looks for her career and trying to maintain that, and being as relevant as she is, you know, throughout, you know, over decades of time, I mean, that's impressive, and that requires some upkeep. And some people might say, well, maybe certain things were overdone. Sure, but you know, still, she has put in a lot of time, a lot of work, a lot of money to trying to keep herself looking as young and youthful as she could. That was her prerogative, and many celebrities go through a similar course over time. If you like this video, please make sure to check out our video on Cardi B and click on the card, and I'll see you there. We're gonna give away another $100,000